In our continuing discussion of telephone triage, this is the second of 2 episodes dealing with clinical pitfalls that can compromise patient safety. Closely related to fatigue and haste, which we discussed at the end of our previous episode, is being multitasked or distracted. Perhaps because our nursing care is being delivered over the phone, some of our colleagues don't take it as seriously as they do when we're caring for patients face-to-face. But it's essential that we keep in mind that what we're doing can be deadly serious. In order to minimize internal and external distractions, it's best if the telephone triage nurse is dedicated to the phone in a quiet place rather than being multitasked with other priorities. An example of this pitfall is found with an RN in labor and delivery who, because she was caring for multiple patients in active labor, missed the signs of preeclampsia in a patient who called the labor and delivery unit asking for advice. The patient had a toxic seizure and an unfavorable outcome. Next, we'll discuss failure to anticipate worst possible, which can be a huge and disastrous problem when assessing a patient over the telephone. While many of us have been taught either academically and or through experience that when we hear hoofbeats, we should think horses, not zebras. As telephone triage nurses, we must look for zebras, or we might never find them even when they're right in front of us. The old adage, if you don't see it often, you often don't see it, can hold true with telephone triage if we're not very careful. An example of this pitfall is found in a case of a narcotic prescription being filled wrong by the pharmacy and subsequently administered wrong by the mother to an adolescent who had had same-day surgery the previous morning. The patient subsequently died of multiple overdoses of the drug in question by her well-meaning mother. Closely related to that notion of failing to anticipate worst possible is failing to err on the side of caution. It stands to reason that if we're going to look for zebras, we must be prepared to act cautiously if we suspect them. The parable of the little boy who cried wolf is a parable that most of us grew up with and perhaps got in trouble about as children, but as telephone triage nurses, if we don't cry wolf once in a while, we're likely to miss way too many zebras. Think back over the examples that we've discussed during the previous segment and this one, and think of how many of those would have required the nurse to be brave in referring a patient with an apparently obscure or implausible problem in for evaluation. Remember, if we're going to err on the side of caution, we've got to be sure that our error is on the side of patient safety rather than resulting in a bad outcome. A good example here is found in a mother who called 3 times in one day for her adolescent daughter who was septic following a bout of the flu. Although the first nurse referred the mother to the emergency department and the second nurse referred the mother to a call with the physician, the third nurse was reluctant to send the patient back to the emergency department. And had she been willing to do so, perhaps there would have been a better outcome. Next, we'll talk about failure to assure continuity of care, which is a problem that is commonly seen with care delivery over the telephone. Because of the nature of our interactions, the encounter over the phone may appear to be episodic. However, we must remember that we're just one step, perhaps the first step, but never the last step, in management of the patient's problem. As telephone triage nurses, we must recognize that we're not personally able to do anything to or for the patient. Someone else must actually carry out the plan that we develop in conjunction with the patient, even if that someone else is the patient, him or herself. Thus, we need to be sure that we've facilitated an informed caregiver in the next step, whether that caregiver is the ED staff, the provider we work with, or the patient or his or her caregiver. Just remember, even the best quarterback won't score if he fails to tell the receiver that he's going to throw the ball. An example here is a wife who called to request an appointment for her husband's leg pain. Although she admitted to the nurse that her husband was having chest pain, that information wasn't communicated to the physician by the nurse. When the doctor saw the patient, the question chest pain never came up, and the patient experienced a sudden cardiac death 2 weeks later. So while we're not the final step, we must remember that we're part of a team, and communication with the rest of that team is critical. And the final pitfall we'll discuss is failure to do an adequate assessment, which is probably the root of most of our bad outcomes. Remember to always use the nursing process, anticipate worst possible, and err on the side of caution, and the safety of the care that we deliver is more likely to be assured. Keeping these clinical pitfalls in mind and doing our best to avoid them should facilitate the provision of safe, quality care over the telephone.
Carol Rutenberg is a nationally recognized expert and speaker in the field of telephone triage. To learn more from Carol about the ideas in this video, you can refer to The Art and Science of Telephone Triage, written by Carol and her colleague Liz Greenberg and endorsed by the American Academy of Ambulatory Care Nursing. This video training series was produced and sponsored by ClearTriage, an online version of the Schmidt-Thompson telephone triage protocols that is compatible with Carol's teachings and widely used as a decision support tool for telephone triage nurses in practices and clinics.